Fibro TV, making positive connections in the chronic illness community.
Hello, fellow chronic illness warriors. Monday Mayday here. Are you ready to have some fun? Now remember, Fibro TV's podcasts are for entertainment purposes and educational purposes only. So if a positive attitude, fruits and veggies causes you to grow a third eye, or feathers, don't blame Jen. She warned you. Now, let's get the fun started. Ha ha!
You're listening to the Daily Dose of Health and Wellness with Jen Reynolds.
Fibro TV, making positive connections in the chronic illness community.
My body hurts.
The information contained on fibrotv.com is meant for information and entertainment purposes only. Any information via audio, video, or print material should in no way replace any advice or direction given to you from your personal physician or medical caregiver. Please consult your physician for specific treatment options.
My headache hurts. I've tried aspirin, Advil, extra strength, Tylenol and such. Nothing seems to kill the pains that...
Oh, hello everyone. My name is Jen Reynolds, creator and founder of fibrotv.com. We are on the Daily Dose of Health and Wellness, episode number 13. And today we're going to be talking about why it is so hard to treat fibromyalgia syndrome. So sit back, relax, and enjoy the podcast. Normally on the podcast, I don't talk about one specific condition. I usually talk about chronic illness because we have a variety of people at fibrotv.com. We have people with rheumatoid arthritis, lupus, Lyme, and I want the site to be, for everyone and not just people with fibromyalgia, even though that's what I started the site for. When I first started the site, I wanted it just for fibromyalgia, but then I realized there was such a need for everyone that has a chronic illness to have a place to come to that's positive and that we can find answers. But I really wanted to touch on the subject of fibromyalgia and how hard it is to treat it, because it is very frustrating when you go to a doctor, they give you something and you put all your hopes into this medication or treatment, and this happens over and over again and it doesn't work and you get disappointed and frustrated, and it's just something that really needs to be talked about. So I appreciate everybody's understanding and patience while we talk about this very important subject. First off, let's talk about what fibromyalgia is for those that do not have it. Fibromyalgia actually means widespread pain in the muscles. People often describe having fibromyalgia symptoms as having like a flu that never goes away. Fibromyalgia is a brain-based disease. It's neurological. And what happens is the neurotransmitters that send signals to your brain to say that you're in pain, they're over-amplified. So a person with fibromyalgia, if you go ahead and you tap them on the back and say, "Hey, how you doing?" Everybody else in the world, they're just going to feel that tap on their back. Well, somebody with fibromyalgia, they hold on to the pain, the memory of pain longer. So if you tap somebody on the back and say, "Hey, how you doing with fibromyalgia?" they're going to feel it for about 30 minutes, sometimes even longer. It just doesn't go away. There's also intense pain and flare-ups. Like any other chronic condition, you're going to have good and bad days, but sometimes you get flare-ups for days, weeks, and months with just intense pain all the time. And there's a lot of other symptoms that go along with it, like irritable bowel syndrome, anxiety. There's just a whole list of things that go along with it. And that's why they call it a syndrome, and not a disease, because a syndrome often refers to a bunch of symptoms without a known underlying cause. Whereas a disease is a disorder of a body system or organ structure or their function. So the reason why fibromyalgia is not considered a disease, it doesn't attack any type of organs like some kind of autoimmune disorder would. It doesn't make it any less validated if it's called a disease or a syndrome. People kind of get that mixed up. It's just the basic medical terminology that they use. So because fibromyalgia is a syndrome, there is no known underlying cause. Now, you're going to have people that are online and they're going to say, yes, there is an underlying cause. There is an underlying cause, but it's always different for each person. And that is why it's so hard to treat. That's why you'll see people who have changed their diet do a lot better, because their cause is because they cannot handle gluten or they can't handle preservatives in their food. So those people do start to get better. There are those that have a bacterial, viral, or fungal infection, and if they treat those, that it starts to get better. You see a lot of people talking about yeast and overgrowth of yeast with people with fibromyalgia, and those people that take care of that underlying cause start to feel a lot better. There's also emotional and physical trauma. If you've had some kind of surgery and it was very traumatic, if you've had abuse, physical or emotional abuse, and you haven't dealt with that and you have underlying anger and resentment, if you deal with that, your symptoms are going to get better. If you deal with the injury, your symptoms are going to start to get better. Some people develop fibromyalgia because of mercury poisoning. So if you take out the fillings in your mouth that are full of mercury, you're going to start to feel better. And then there's a group of people that have something called secondary fibromyalgia, and the root cause of their fibromyalgia is another disease like rheumatoid arthritis or lupus or Lyme disease, and they develop secondary fibromyalgia. And if they treat the first problem, then the second problem will start to be better. And then there's this one group of people, and this happens to a lot of people because doctors tend to just throw tons of medications at you. You'll be on like 1 or 2 medications, and then you have some kind of side effect, and they throw in another pill, and you have a side effect for that one, and then they throw in another pill. And you start to get something called rebound pain, and that could be the source of your pain after a while. So you got to watch that. It can cause more pain, or it can even be the source of your pain. So if you go ahead and slowly go off those medications, you will start to feel better. And there are many other causes of fibromyalgia that I haven't touched on. I don't want this podcast to be too long, and there's a lot of different reasons why people develop it. And I think the key to treating fibromyalgia and have successful pain management or condition management is to find what the underlying cause is. You need to go back to when you first got sick. What happened in your life then? What happened? Did you have a traumatic birth? Were you in Iraq in the war? You got to really look back and figure out what the cause is. Because until that underlying cause is treated, you're going to just have more and more problems, and the medications are not going to fix it. It's just going to cover up the symptoms, and after a while, they're not going to work anymore. And I always tell people when they ask me, what's the first thing I should do for my fibromyalgia? And my first thing I say is to get healthy, your entire body healthy, and get on a healthy diet, eliminate sugar, don't eat processed foods, eat whole foods, drink lots of water, get rid of the sodas, and just feeling better health-wise helps fibromyalgia. And then my second thing I tell them is to go get tested for food allergies, because that is the one thing that can be fixed, and you will have no more pain if you find out what your food allergy is. And that's an awesome thing. And this is why we have such a low success rate with treatments with fibromyalgia, because each of us are different and our underlying cause is different. And finding that underlying cause is key into having successful treatment and managing your pain. And it's going to take a while for you to find it, but it will be so worth it when you see a reduction in your symptoms. Doctors are only going to prescribe like Lyrica or pain medication or Cymbalta, and they're great tools for a while, but staying on these medications for long periods of time actually cause other problems within the body. So to treat the underlying cause is going to be the most effective way to treat your condition and to feel better in the long run. Doctors just prescribe medication, and that's how they're trained. They figure out what's wrong with you and they prescribe. They don't go to the underlying cause unless you go see a naturopath doctor, one that actually does treat the body. And this can get quite pricey because they don't take health insurance, but you really have to look at it like, oh, this is an investment in my life. So if you can get in to see one, if you can save your pennies to go in and see one, I can guarantee you'll be really happy with the results. Always keep seeing your doctor, though. I always tell people to continue to see their doctor because in case something else comes up that they can test and treat. Even though fibromyalgia is very not treatable right now in the Western medicine world, there's very few treatments that actually work. I read somewhere that the treatment for fibromyalgia, successful treatment, is less than 10%, and that is just utterly ridiculous to me. So there needs to be a lot more research. But for now, you're going to have to be your own advocate and find out what that underlying cause is and work with that because you deserve to feel better. And, I found out mine was from a flu shot and also from a virus. I've treated the virus and I no longer have Epstein-Barr virus, so I feel a lot better. I don't have the chronic fatigue syndrome anymore. Also, I have a very sensitive gut, and it doesn't like any processed foods, so I eliminated processed foods and I eat a whole foods diet, and those things have helped me because those were my underlying causes. And another thing, I had to work from an emotional side as well because I tend to hold on to my feelings. I've always been that way since I was a little girl, and holding on to feelings can actually manifest into physical pain. So as you could see, for me, it wasn't just one thing. It was like a whole group of things that I had to do to start to see symptom reduction. And now I have a few flare-ups a year, and I used to be in a constant flare. So it's been totally worth it to me to put in the time and effort to find the underlying cause. Well, that concludes today's daily dose of health and wellness. Thank you for listening, everyone. I always appreciate when anybody listens in. You could find us over at Facebook at facebook.com/FibroTV, YouTube at youtube.com/FibroTV, Twitter at twitter.com/FibroTV. We're also on Google Plus and iTunes. Just do a search, put iTunes FibroTV or Google Plus FibroTV. And also, you can find us on the World Wide Web, our official website, www.fibrotv.com. Everybody have a great night. Until next time.
And my stomach hurts.
Thank you for listening to The Daily Dose of Health and Wellness. The Daily Dose of Health and Wellness is written, produced, and edited by Jen Reynolds and released every Thursday, right here at fibrotv.com.
My mommy is sick, but she's the best mommy in the entire world, and I just want her to get better.
Fibro TV, making positive connections in the chronic illness community. You can find us over at www.fibrotv.com.